Welcome back. South Africa's health sector is marred by deep-rooted inequalities, with millions relying on an overly strained and under-resourced public healthcare system. This is revealed by Open Secrets in a report titled, "Who Owns South Africa?" The report chronicles the role of private healthcare in exacerbating the inequalities. And to unpack this further, we are joined by investigator at Open Secrets and co-author of the report, Luvano Ntuli. Luvano, thank you so much for joining us this evening. And what a thorough and fascinating report that you have published there at Open Secrets, taking healthcare all the way back to the early days of private healthcare, 1652. If you could just start by a brief education around how it was created, its foundations, and how that legacy is still remnant today.
Thanks so much for having me, Masa. And yeah, so throughout this report, we try to highlight the role that corporate power has always played in the healthcare sector. And so by tracing it back to 1652, the colonial era, the apartheid era, what we're really looking at is how financialization and corporate power has really consolidated within the sector and what this has meant for everyday people living in the country.
You know, there were quite a few fascinating outcomes from that as well. You also flag a 2021 Concourt ruling that upheld a decision to say that Mediclinic should not build another hospital. Now, when you're looking at the disparities of South Africa and what's going on in the public healthcare system, one might think, oh no, why would the courts rule to say that we shouldn't have more hospitals or private clinics?
So with that ruling, it's actually quite interesting because what the courts are essentially telling us is that while the assumption is that there's a creation of more hospitals, therefore more access, the fact that Mediclinic would be the one opening these hospitals is really concerning because they have such a large concentration of power within the private hospital sector. And this is what we look at in the report, is how three major hospitals, so Life, Netcare, and Mediclinic, are the three main private hospital groups in the country. And so what the ruling is really showing is that, you know, the Constitutional Court is telling us that corporate citizens actually have a responsibility to ensure that they aren't consolidating power as much as they continue to have been doing in the country.
One might say, you know, at layman's terms, just thinking about this and thinking about what's going on, for instance, at the Tembisa Hospital, and we're seeing the kind of gross corruption that's taking place in that sector as well, of the public sector. Can we then say that the private sector is taking advantage of these inefficiencies? And if so, so what? There's a need.
I think that's a good point, but what we're trying to really understand is the issue of profiteering and profiteering by private actors. I think what you've spoken to with the corruption with Tembisa Hospital is jarring because it represents one aspect of corruption that is happening in the public healthcare system. And rightly, I mean, as you've said, you know, the private healthcare system is taking advantage of an unequal system because more people who would rely on the public healthcare sector are then turning to the private healthcare sector, but that's completely unaffordable and also has its own inefficiencies. So it's not like private hospitals are any better than public healthcare. It's just that we know about the issues in the public healthcare system a lot more than we do in the private.
And if you could just also please elaborate on some of those inefficiencies as well. You spoke about pricing, which is also a big problem.
So what we see with pricing is that we relate it quite closely to financialization and the issue of, you know, financial actors taking a stake in these private healthcare, in the private healthcare sector. And what that means is that, you know, prices go up for the consumer because what these private actors are really interested in is shareholder payouts and dividends. So even though, you know, we might see the private sector as being probably a little bit more efficient, what we actually are seeing is that the costs are high because they ultimately have shareholders that they're trying to line the pockets of.
Yeah, and just on that point as well, Luvano, I want to just quote something from your report too, where it says, there are limited circumstances in which a corporate must have regard for the public interest when making decisions that may affect that very public. Surely then this is where the nub of the problem also starts as well.
100%. And I think we can see this in the way that And I'm sure we'll come to this a little bit later, but I think it's important to talk about the corporate lobby versus the NHI, the National Health Insurance. I think what we're seeing here is that the private sector is really interested in lining their own pockets. And so when it comes to the interest of the public, none of that exists. It's all about the payout at the end of the day.
You also talk about it being expensive to be healthy as well. The ordinary citizens are faced with two options. It's either you're going to pay the exorbitant amounts in the private sector and hopefully get a good service, or rely on the public sector, which we've seen across the board failing.
Yes, that is very true. I think what we're seeing is that, ultimately the reason that the costs are so high, especially in the private sector, is around, the profits that the corporations are ultimately trying to make. And so the interests of people are not protected by any means. There is a high amount of expenditure. The public pays a lot for both healthcare, but also for medical aid cover. And so either way that you're looking at it, it is expensive to be healthy, unfortunately.
And also, Luvano, it seems that this is a problem across the board. From your report as well, it shows that the continent of Africa averages health allocation in terms of budget was just 7.4%, and over 95% of AU countries failed to meet that commitment that is still a single digit.
Yeah, it is actually quite sad. I think, South Africa ranks quite high in terms of how much of our budget is actually spent on healthcare. And I think comparing it to other African countries really does put it into perspective of, as much as we are spending, over 200 billion on public healthcare, ultimately we can't see what that looks like or translates to in real terms. And I think if you compare us to the rest of the African continent, it is kind of shocking to see that, those numbers don't add up.
So what does this all then reveal when it comes to, you touched on it just a bit earlier, when it comes to the National Health Insurance?
So what we've seen is that there is a large corporate lobby that is actively vying against the National Health Insurance. And, what we speak about in the report is this corporate lobby. So we're looking at representatives of medical aid schemes, business interests, and those kinds of things. What they're doing essentially is pushing a narrative that there are issues around, the National Health Insurance, related to funding and all of that. But what the corporate lobby is doing is kind of pushing it around this issue of choice, saying that what is envisioned by the National Health Insurance ultimately limits the choice of the consumer. And we argue that it's not, the private sector isn't about defending our choice and what, we choose for our healthcare providers. It's actually ultimately driven by profit. They benefit, medical aids benefit from the lack of a national health insurance in the country. And so I think these are kinds of the issues that we've come across is how do we regulate the corporate lobby? How do we regulate these powerful corporate entities that are then determining? We've said in the report that there's only about 15% of South Africans that actually have medical aid cover. And so when we think about this 15%, that's who's being represented by the corporate lobby against the NHI. And so that is not representative of the country as a whole.
Luvano, thank you so much for your time this evening.